In this discussion, I will argue that maternal health disparities among Black women are driven by systemic racism, healthcare bias, and social inequalities. I say this because Black women face disproportionately higher rates of maternal mortality compared to white women. And regardless of income or education, in this conversation, we will cover the impact of structural barriers, the role of implicit bias in healthcare, and the need for equal solutions. We will reference medical apartheid, battling of a bird, and an external source under the shadow of Tuskegee, African American Woman and Reproductive Justice by Loretta Ross. This article addresses the historical and contemporary challenges faced by Black women in healthcare, particularly in relation to reproductive justice and maternal health. It explores how the legacy of unethical medical practices like the Tuskegee syphilis study continues to influence Black women's experiences with maternal health care. So when we're overviewing maternal health care in general and the disparities, maternal health disparities refers to the unequal health outcomes and access to care experienced by individuals during pregnancy, childbirth, and a postpartum period. These disparities are often driven by systemic factors such as racism, social economic inequality, healthcare bias, and inadequate access to quality medical care, leading to higher rates of maternal morbidity and mortality among certain populations, particularly women of color. Maternal health disparities are a serious issue with Black and Indigenous women, where they face higher complications and deaths than white women. These disparities aren't just about biology, they're rooted in systemic racism. And Black women in the US are 3 to 4 times more likely to die from pregnancy related causes, even when factors like outcome, income, and education are accounted for. Tackling this problem requires addressing healthcare bias, improving access, and confronting the social inequalities driving these disparities. These disparities also reflect broader social detriments of health, such as housing, education, and employment, with heavy influence on chronic stress, often tied to experiences of racism and discrimination, which further exacerbate these risks, contributing to conditions like hypertension and preterm birth. Additionally, many healthcare systems lack culturally competent care, leading to miscommunication, mistrust, and inadequate treatment for women of color. By addressing these root causes and prioritizing quality and maternal health, we can work towards closing the gaps and ensuring safer, healthier pregnancies for all women. Would anybody like to add anything to that?
I think it's really sad that, we're in 2024 now and we're still having to deal with these issues with race having an effect on the healthcare that we get as not just women in general, but women of color. It's really sad that we have to sit here and have this discussion because it continues to be a problem.
Yeah, I just want to add that I think it's like it just keeps scaring me. Oh, are you talking? I thought she was okay. It just keeps scaring me or it scares me to just think about how, like, I really got to think about these things to, when I think about wanting to have kids, like the probability of me not even exiting out of that hospital room because of the fact that I'm Black and of course I'm a woman, and even as Malcolm X said, like the most hated person in America is the Black woman. And yeah, and that just scares me because I do want to have kids. Like my mom, I want to be like her, especially as a mother. So she inspires me to want to have kids, and just the fact that I just love kids. So yeah, but that is kind of a drawback for me. And I'm like, I don't know if I really want to have kids because I don't want to die, essentially. And I hate that it has to be like that for us.
Are any of you guys like, as we get older, we start to like map out our lives, like, oh, I feel like I want to have children, such and such. Are any of you guys like planning to take certain precautions moving forward, knowing that these disparities exist in maternal health, specifically around Black women?
Yeah.
You
Go
know.
ahead, Cameron. Okay. I was gonna say specifically, number one, I definitely want a Black gynecologist. Um, I'm also gonna like be really keen on like breastfeeding my child because I want my child to be close to me. I want them to have immunity, and I want my body to bounce back too. Um, I want to work like alongside with a doula or a midwife. I'm not sure if I really want to have a baby in the hospital yet because of the atmosphere. And I know things are going to change within the next like 5 to 6 years when I do have a kid, or even 10 years down the line. It's probably not going to be a big difference. So yeah, those main things, like having a Black physician and the breastfeeding and the doula, those are my main things.
I agree.
Yeah, I was gonna say the same, like definitely Black people around me and just being cautious. Like I definitely wouldn't necessarily do a home birth to like counteract that because that's just not for me. I need all of the, medical tools and stuff, but I just make sure it's like people that I actually trust and like actually I can tell care about me and stuff.
Yeah, I would definitely want a Black woman as my doctor because I know there's a good bit of men in the field of gynecology and like good for them. But me personally, I would want a Black woman to be taking care of my Black woman body. That just makes the most sense to me. Um, and it's just scary to see where we're going to be in the next 4 years because who knows what giving birth to a child is going to look like. So as of right now, that's like my only must, but we shall see.
For me, I'm definitely gonna try to get a doula or a midwife because I see like the statistics compared if you don't have a midwife or a doula to if you do. And I'm sorry, that convinces me like all the way that I need a midwife or a doula to just even support me throughout the pregnancy and just kind of be there for me in every way, like, spiritually, mentally, emotionally, all of that. So yeah, I'm definitely gonna get a Black doula or midwife just to understand me in that way as well.
So my reason hits a little home. So I now have a Black doctor, but the first time I got a Black doctor was back in 2020. My mom was pregnant with my little sister, and she actually lost her due to preeclampsia. She was 7 or 8 months. And basically what happened was, back in 2020, I don't know if it happened like that, because I know we're from different places, but it hit our area around March timeframe. So when March came, the school shut down and they was like, y'all won't be returning until the next school year. And so I remember going because my dad started working from home, so he couldn't go to her doctor's appointment, and I ended up going with her. But I had to stay in the car, and she went inside. And basically, when she get inside, long story short, they tell her it's no heartbeat. The baby died due to preeclampsia. Now, keep in mind, preeclampsia is something we were never educated about, and my mom has been suffered from high blood pressure, but she was never made aware of her risk. Um, no risk, no education behind what could happen behind the birth. It was just nothing. So when they presented her with your baby has no heartbeat, of course she was distraught. She was looking for answers. She didn't understand what happened. And I think that's literally when I had a turning point and I was like, I want to be an OB. Like, I want to be OBGYN because I need to make sure stuff like this, I'm looking at everything. I want to see the patient history. I want to look at everything. And not to say that we could prevent it, but it's like I want to try my best to make sure if it does happen, I want to know I did everything on the line to make sure to try to prevent it from happening. And if it did, then I know I gave my best. So I think moving forward, I definitely agree with having the Black doctor. And as women, we also have to do our research to protect ourselves. Because sometimes we do put it all on the doctor. And I just think now, like seeing that happen to my mom, I do think that she could have did some prior research to knowing that women over the age of such and such, I think it's like 32, you're at higher risk of having a child. So doing our own research as women, getting Black doctors, getting doulas, having a support system for pre-postpartum and after postpartum. Um, yeah, that's basically all.
Um, so I'm gonna cover more about the Black women have being disproportionately affected by low birth weight rates and mortality. And so in this discussion, I will argue that Black women and the United States are disproportionately affected by low birth rates and adverse pregnancy outcomes. I say this because due to systematic racism, socio and economic factors, and healthcare disparities, Black women do not have the same standard of care as white women. So, the Black people in general have a very adverse relationship with medicine. And I know we've talked about that in class multiple times, and just like, and I know in post-traumatic slave syndrome, they go into the history of that and why we are like that and why we still hold that. And basically, we, Black people are not treated as equally by doctors, and their pain a lot of times is seen as not the same. And that is why a lot of times we are dying from stuff, especially childbirth, faster than white women. I found this source, and it was just saying that basically Black people in 2021, 14.6 Black live births were preterm. White was only 9.5. So that's a very recent source showing that like it's just not the same. And just race plays a huge part, especially in the South. People, white doctors just aren't caring. And then and battling over birth, they talk about all of the struggles that Black women go through. So the inadequate support that we have in the hospital, and just sorry guys. Just the access to good healthcare in a lot of Black communities is not there. Therefore, Black people are not getting the healthcare that they would need, good healthcare. And so that's one of the things that contributes to Black women dying more. Racism, as I talked about with the post-traumatic slave syndrome. And yeah, that's all I have. I don't know if anyone has anything to add.
Yeah, I was actually going to ask about the post-traumatic slave syndrome. Like, could you like kind of explain that, or do you want like us to kind of explain it?
Oh yeah, I can explain it more.
Okay.
So, in the book, she talks about one of the things she talks about was that basically since slave times, like, well, let me start over. Even though we are in 2024, obviously Black people still hold the trauma of slavery. Most Black people, let me just preface, because some people say they don't have the trauma from it, but most Black people still hold the trauma from it. Therefore, when you go to the doctors, and mind you that, you know, we're at Xavier, almost everybody's pre-med, and we're trying to change the fact that most doctors are white. Like, I don't know the exact statistic, but you know, most Black doctors are white. And then, so when you go to the doctor and you're seeing all these white people, you automatically just have a lessened trust off rip. But then you, white people are still racist. So it's working both ways. We don't trust them. They don't like us. So we're just not getting the adequate amount of care that white women and even other minorities get due to the history of slavery.
And I also want to add, like, yes, it's slavery, but like, it's so many other things that they did to target Black people. It's almost like a buildup. Like, things just kept building. They never did treat us fairly. And even still to today, I still don't feel like they treat us fairly. And to cite my external source, Under the Shadow of Tuskegee, African American Women and Reproductive Justice, and by Loretta Ross, to quote her, she talked about how in the Tuskegee experiment, it was, of course, 600 men. And with that, like how they, injected them and everything. But she also made a point where like that's where the distrust started when they did things like that to us. So 399 of the men who had syphilis and 201 who did not, they were never informed that they had syphilis or that they were treated for it. And even after penicillin became the standard and effective treatment for the disease in 1940s, the researchers wanted to observe the progression of syphilis in untreated men, and this study impact on Black communities has had lasting effects. It contributes to deep mistrust of the medical system, particularly among African Americans. And I say all that to say that I think that we just always, when walking into a doctor's office, you're always wondering, does my doctor have my best interests? Is my doctor looking at everything? And it's like you want to tell your doctor everything, but you may not think your doctor is going to look at it the way you're looking at it. And I know sometimes I've even seen where a Black woman could say, "Oh, my pain is on the level 10," and sit in the ER before, like sit in the ER waiting room before a woman. I mean, and still be sitting when a white woman says her pain is maybe at a level 5 and get taken in before. And
Mhm.
things like that, I think it's just a buildup of medical distrust. I'm done if anyone would like.
Yeah.
Also,
Oh,
oh,
sorry, go ahead.
sorry.
But to add to that, kind of like we're talking about Tuskegee and stuff like that, like with reading Medical Apartheid, there's also the story of Fannie Lou Hamer, who she thought she was just getting a routine procedure, getting a cyst or whatever removed, and they ended up sterilizing her without her knowledge. So it's like this was in 1960, but even before that,
Mhm.
it's like we've been going through so much and to no avail. Like I said, we're here in 2024 still having these same conversations about the unequal treatment of Black women in healthcare.
Yes, because in the Tuskegee experiment, they actually misled them and told them they were being treated for bad blood instead of actually telling them of what their disease was.
Yeah, and I would also like to add that I feel like events like the Tuskegee experiment, even like past like, experiments that were done on Black people, just because like, since we were disregarded as humans, or we weren't believed to even really be human, that gave them more of an excuse to just experiment on us to see what kind of treatments will work best on, whatever. um it is sad because that obviously creates like the stigma or like the problem of Black people not trusting medical care. And um and that can be that's obviously a problem because we do need healthcare, we do need doctors, we need medicine and all that. And so it's just the fact that it's all like a big cycle. It's all like a big circle that, they really don't like us. They don't really want us to live. They don't want us to thrive. And so it's like they create these things and like all these things happen to us to the point where like, obviously this is going to create a more of an environment for us to not, get better in a healthy way just because, of the traumatic experiences or the events that they put us through. And it's just sad to think about for our people that it has to be like this for us.
And that all stems back from PTSD, I believe it's called,
Mhm.
post-traumatic stress. PTSD? No.
PTSS.
PTSD. Or wait, is it PTSD or is it PTSS? Whatever it is,
PT.
I think that all stems back from that because, like you said, they look at us as objects, not real people, not their equals. For the longest time, we were called monkeys. We're still into they called monkeys. So it's like, why do we deserve to live? Why do we deserve equal health care? Why do we deserve to be in the same areas? And it's like, even when I kind of see people of color today, I just think like, I wonder, like, do you like me? Like, I feel like it's so hard to judge people's true intentions. And I feel the same way in the doctor's office. Like, are you a doctor because you want to help all people? Or are you a doctor because you want to help your people? You know?
Mhm.
Yeah.
And piggybacking off of what you were saying, um, Janae. The article I had, which was AP News, written by Kat Stafford, she had was telling a story of this lady in Alabama, and they were saying that the they are Black women with a college degree or higher have a higher birth mortality rate than Black women without a college degree. And then Black women with a college degree or higher have 1.6 times higher mortality rate than white women without a high school degree. So just that piggybacking off what you were saying about they don't want us here, like they don't want us to succeed.
Right, like it's really just a big plan. Like they really don't like us being educated. They don't like us being, succeeding. It's just wild. Like we're really the first here anyway, so it's just crazy.
But doesn't that make you, I don't know personally, but doesn't that make y'all like hungrier for it? Like knowing that people don't want you in the space? Because I know for me it does something like it makes me hungry. It makes me want to get that degree and it makes me want to stand next to the white doctor and be just as educated, if not more educated. And I'm proud to go to my HBCU. Like I've never, when I was applying to colleges, y'all, I didn't even apply to PWIs. I didn't. Like it was something I knew I needed. It was like I want that part of me so bad. And I want to go in that field, and I want to be the black doctor from an HBCU who's just as well educated as the man from Harvard, the white man. Like I wanted it. It made me hungrier.
Yeah. I was gonna add though, y'all had really good points too, but I was gonna add that what I get from PTSS also is like it's also kind of made a lot of Black people like anti-Black, like or kind of like I feel like that also has an effect on like colorism, Black on Black crime, gun violence, because it turns into more of like a hate for yourself instead of like a hate for other people, because systemically that's what was put on us to not like ourselves and not like who we are in general. So I feel like that has led to a lot of other things, or like even just how you mentioned like going to Harvard, like the white man, like a lot of Black people look up to that as a big significant thing, but it's like, why is it not okay to get the same degree from an HBCU? It's just as equal. You have to do the same amount of work to get there. But because they put so many things on a higher pedestal, or like even like materialistic things, like, oh, I need to get Chanel, I need to get this. Like, why are we buying all these white expensive designers and not supporting each other? And like, it's just stuff like that that I feel like that comes from PTSS and like negative behaviors and all this like mental illness and us not liking each other, because we all know we have like this thing in like our Black community itself where it's like it's a lot of like back to back over little petty things, you know, like hair, or she got good hair and this and that, and she, just stuff that doesn't even make sense, but that all is rooted like from slavery. So yeah.
I like what you said about colorism. 'Cause colorism and like the good hair topic or debate is such a problem with our community. Like all hair is good hair. Like, okay, maybe her hair is, I guess, easier to detangle. That doesn't mean that it's better than my hair. Like, and then, okay, if you're darker than me, that means you're less beautiful than me. Like, that's not how this works. I hate that for us, that it's just so embedded in our community. Like we're supposed to be together from all the stuff that we've been through. So it's like, why is there so much division? But it does go back to just even like how, like I said, like they just really don't want us to succeed. So it's like they even like this is kind of what they did, like even through slavery, like you said, like it's just how what they really ingrained in us. And so now we're like, it's just kind of like programmed in our minds, or like, in our community's minds, that, oh, the lighter you are, the prettier you are, or the looser your curls are, the more attractive, or whatever. So like I said, it's all just it all kind of leads back to them. Like it all leads back to what they did. And like just the whole thing of slavery and just everything. Like it's crazy how this dates back so far, and like how they really played a part in just how it is for us as Black people.
And Janae, when you say that, I swear you took the words out of my mouth because I just tweeted a post the other day and I had to pull it up to read it to y'all word for word. It said, They saw a post that said racial programming is why you think Beyonce and Jay-Z sold their souls to the devil for their success, but Jeff Bezos and Elon Musk worked hard for theirs. And I feel like that's so true because on the media now, everything is tearing down black successful people. And then when you see white successful people, it's like, oh no, they worked hard. They did it, they did everything they had to do. And as soon as a black person make it, it's oh, you did something bad to get there.
And
And
it's
that's
black people saying that about them.
yes, it's black people, and it's racial programming. Because just as y'all said, it's been since the beginning of time. They put us against each other, and it just never left. Like we're still hundreds of years later, somehow still going against each other, and it worked. They were successful at it because now people pick up the idea that it is good to go against your own people. The same reason why a black person could make a nice store in their neighborhood, put a corner store, and a corner store get no support. But then some Asian people could come in a corner store is popping. You know, same store sell the same thing, but because the black people own the store, it won't get no support. But then the Asian people come in and gets all the support because they don't want to see the black person win. And I think it's so crazy that y'all right, it stemmed from slavery. It stemmed from the racial programming that they put on us years ago for us to go against one another.
Me personally, I'm waiting for the moment that it's like a black owned like beauty supply or beauty salon, whatever in my neighborhood, because I'm honestly tired of seeing Asian people like handling like my hair. Like, girl, like why is there not someone that look like me behind the counter? I'm just saying.
No, I agree. And black people do too. This is the thing that I'm tired of seeing. Like, not saying this is a universal thing, but certain nail salons, certain beauty supplies, or just anywhere where it's not black owned, when they're not treating us right, or they have attitudes, or the service isn't up to par, we shouldn't be continuing to support them. That's a big problem. And I feel like a lot of black people, they so lazy that they just like, oh, I'm gonna keep going because it's easy or it's affordable. But it's like you're supporting something that's subpar. But you complaining when it's a black owned place that maybe might be 30 minutes away, it's a little bit more expensive, but you getting more for your money. And you know what I'm saying? You getting treated nicer. But it's just like that doesn't make sense to me. I hate when black people continue to support something that's like so beneath level of what we should be getting, and then it's just making them more money and not helping us at all.
I also just thought of another thing of racial programming, or also I don't know if this would be racial programming because it's the white person, but to tie us back to maternal health disparities. Um, do y'all know it's like when a black woman is maybe in a grocery store shopping alone and she's pregnant, people automatically assume that she's a single mom. But then if the white woman is shopping and she's pregnant, it's just oh her husband's at work. Like we're automatically thought to have some type of disparity in the household, in the healthcare, like everything is just like y'all just don't got the picture. Like y'all just can't get it. Y'all can't live a regular life. Something got to be wrong with y'all. I think that also is a type of racial programming.
Yeah, it is sad how that sticks out. Like you said, if a pregnant black woman is seen alone, oh well, her baby daddy left her, and it's always like the words baby daddy has a negative connotation within the black community. But with white women, if they're seen alone, oh, their husband, they're automatically married if they're pregnant. When you look at white women, but black women, oh, their baby daddy left them, they're single, their kid's not going to have a father in their life. It's we're automatically seen as less than off rip.
Especially, I feel like if she like has multiple kids with her, it's not like, oh, like husband's at home or husband's at work or whatever. No, it's like she has all these kids, like probably don't have a job. No, like it's just versus the white mom might probably doesn't the white person probably doesn't have a job. She probably stay at home mom with all these kids because they just be popping babies out like anyways. But yeah.
But I feel like movies kind of like played a part in that. Like, oh, like the single black or the baby mama, blah, blah, blah. Like a lot of the movies we love today, like Boys in the Hood. I'm sorry, I love that movie, but there's so many like stereotypes in that movie where it's just made it worse for us as black women and black people in general. And yeah, it's just, yeah. So thinking about like all that you say, like I kind of like thinking about some of the movies that I even watched. Like I feel like that's definitely played a part in like how people view us as like the baby mama or baby daddy or they're single, they have all these kids, blah blah blah. So
I know we love Tyler Perry, but yeah, his movies play a big part. Like,
Yes, I agree with all of that. That was all great, guys. I loved all your commentary. But now I want to move on to how incarcerated women are affected by maternal health disparities. So, first of all, the treatment of incarcerated Black women reveals not only systemic issues, but it contributes to health disparities in maternal care. These women often face inconsistent access to health care, inadequate prenatal support, and harmful practices such as shackling during labor, which induces physical and psychological stress than they already have just from having a baby and being incarcerated. The use of restraints remains legal in many states. It can lead to complications, including restricted mobility, increased risk of falls, and interference with necessary medical interventions. Additionally, separation from their newborns shortly after birth further compounds maternal stress and increases the risk of postpartum depression, which can have long-term effects on both the mother and the child. These challenges disproportionately affect Black women who already face higher rates of mortality, maternal mortality or morbidity due to systemic racism and socioeconomic inequities. The lack of standardized care protocols across facilities means that incarcerated Black women often receive subpar prenatal care compared to their white counterparts in their communities, despite their heightened vulnerability. Programs like doula and midwife support have shown promise, but their availability is not consistent and it's not always affordable. Addressing the health needs of incarcerated pregnant women is critical to closing the racial gap that we experience in maternal health outcomes. Without targeted interventions, policy reforms, and more access to doulas and midwives, the cycle of inadequate care for our babies, Black babies, will consistently have poor outcomes, and it will also reinforce broader health disparities within the Black community. I just wanted to ask, like, if you guys had any input about any incarcerated stories about Black women, or just how do you feel about the matter?
Well, I know
With
for a fact.
oh, go ahead.
Oh, you go, Cherish.
Okay. I know with like hearing different stories about like women in prison that are giving birth to their children in toilets and stuff like that because the guards won't let, or they can hear that the woman is in pain and they ignore her, or they won't listen to her about, hey, like I'm in labor. Like it's really sad that just because, yeah, they may have committed a crime, that doesn't mean they're less than human. That doesn't mean that their child doesn't deserve the best shot at life. So it's really sad that just because they're in jail, that means that they can't have a good birthing experience.
And to add to what you said, Cherish, I think it's also important to note that every woman in jail is not just a regular healthy woman. Healthy women, some women go to jail and have actual health problems. Some women go to jail and didn't even know they was pregnant probably, because I've seen that happen. And then you put them in a position to where 9 months go and they don't get the appropriate health care to check on their children or updates, and then you can face problems such like preeclampsia, preeclampsia or preterm birth, things like that. So I think it's unfair. I do think it's something that needs to be fixed in the healthcare system, and that's really all.
I was gonna add to what Cherish was saying, like when the women, she said women were having babies in the toilets, or like in that one video we watched in class, it was actually like a jury hearing or something like that. But basically that woman was saying that she was also restrained when after she had her baby, she couldn't even look at her baby. When she gave birth to her baby, she had to give birth on like a cold table. And this was after multiple times she had to explain to them that she was giving birth and was about to be in the process of having birth. Um, and it didn't have a curtain. It was no type of privacy. Other inmates could come by and watch her. It was just like she was a show in a circus. And I just feel like, yeah. And also too, the restraint thing to me is a little odd because it's like every woman in jail isn't in there for murder or like something so severe. So it's like I feel like that should be based on like mental health requirements and like what the severity of why they're in prison in the first place is. But yeah, I just think that's very traumatic, and something has to be done to where the women can still have access to their child and their health is still a priority no matter what, because they're still human, and that's a natural human right. Okay, Janae, are you ready?
Yeah, let me get my notes up real quick. All right, so I had the advocate for like doulas and midwives, and I kind of went more into detail of how you can just advocate for Black women, period. So I will start with the midwife first. But my argument obviously is that Black women basically need to have more affordable access to midwives and doulas and just support and just a lot of other stuff that I'm about to explain. Just to give a little preview of what I'm going to say, I argue that we need to diversify the healthcare system with just making sure that we have more Black people and more so Black women as doctors or OBGYNs. And like I said, increasing access to doulas and midwives for everybody. I mean, it doesn't have to just be for Black women. It should be for everybody because everybody does deserve to have that experience of having someone that is really for you while giving birth. And obviously having culturally sensitive doctors and nurses. And also having, we're also supporting like legislation as far as like laws that are being passed to support Black women or to reduce the rate of Black women dying during childbirth and just other complications that happen to it or happen during it. And also just another, and I argue that we need to start educating our Black women as to how we can deal with potential discrimination or inadequate health care when we are giving birth. And just educating them on their rights as patients and not just as giving or as birth givers in general. So the two sources I will start with from class is obviously the Battling Over Birth. There was a specific part in the Battling Over Birth where it talked about how Black women are more likely to have disparities as far as accessing decent prenatal care and just as far as accessing doulas and just healthcare in general. And a few like characteristics that Black women have listed as like a positive or as signs of a positive relationship that they may have with their doctor. So to just shorten or an example is having emotional psychological support. There was a quote from the book that says that how this woman who was about to give birth to her baby saying now she was so worried about it and how her doctor was like, you don't worry about anything. I'm the one that has to worry about it all. That goes back to just having just culturally sensitive or just overall sensitive doctors in general for Black women giving birth or just women giving birth in general. Kind of taking on that worry for themselves or just kind of sharing that worry with them, not making them feel bad about it, anything like that. And then kind of just going back to how it is just a huge problem for Black women giving birth in general. Inside is the YouTube video called Inside Georgia's Maternal Mortality Crisis. As we all know, Georgia, Atlanta, there is a lot of Black people in that state. Basically, just all we all know in southern states, there's just more Black people in there. So the fact that obviously this is a state where this problem is just so prevalent and very heavy, that kind of just goes back to my 3 points of how we really need to educate people and educate just everybody that this is a huge problem and how we can really combat it. So in a few articles that talked about some of these solutions is how can we solve the Black maternal health crisis? Like I said before, they said advocacy for reform in health systems and education that seeks to unravel the legacy of these practices by reckoning directly with racism, seeking to diversify the healthcare workforce, and providing Black moms with culturally sensitive care. And also they talked about how having doulas and midwives, the more people have doulas and midwives, the less likely these women will have to receive C-sections, less likely to have preterm birth, and more likely to breastfeed. And then another article that says 3 ways to advocate for Black maternal health, it talked about how supporting legislation could really help also fight the growing rate of Black maternal mortality rate. Laws such as the Black Maternal Health Caucus in the U.S. House of Representatives, or no, sorry, the Black Maternal Health Momnibus Act of 2021. Just kind of researching on certain like legislations and laws that are trying to, or bills that are trying to pass that try to reduce this problem is another way that we can just advocate for Black women outside of just advocating for Black or for midwives and doulas. And like I said before, empowering Black women is also a solution, and that goes for just letting Black women know that they have rights as patients, and also how to like deal with the recourse or how to gain alternatives to whenever they do experience discrimination against their healthcare providers. And yeah, that's pretty much it. All right,
Okay, so like to piggyback off of that, we're watching I think it was an ABC News video from class. They talked about how the number one reason that Black women tend to reach out to doulas and midwives for their births is because they're scared to turn to the standard medical field. Typically, Black women, they feel disempowered when it comes to their health care and things of that nature because they don't feel heard. So, in my part of this discussion, I will argue that the Black maternal health crisis can be fixed by listening to the Black mothers. I say this because studies have shown that avoidable complications are less likely when the mother's wishes and concerns are respected. My portion of this conversation will discuss the importance of listening to Black expecting mothers. So we've all heard of the strong Black woman syndrome. Like Black women are people think our pain tolerance is higher than your average person. We're not looked at as people that deserve medicine. Like, oh, she's used to it. She'll be fine. She doesn't need that. And that plays a big role in the maternal health crisis because Black women are looked at as stronger when they're reaching out for help or like, hey, something's wrong. They're like, oh no, you're fine. They're not listened to. And it's sad, but unfortunately that's what happens in the healthcare field, which, like, going back to what Janae said, which is why we need doulas and midwives, especially for Black women, to help them feel heard, and so that way their voices can be listened to. And with going back to battling over birth, a major part of that book was talking about how the not only doulas and midwives but healthcare in general needs to support the mother's vision for birth. The staff needs to be trained to develop better relationships with the mothers so that way they can be heard and feel trusted with their healthcare providers. And I watched a video that's called Black Mothers Matter, and one of their main points was saying that the Black maternal health crisis, it highlights the problem of society not trusting Black women and not believing in Black women. And it leads back to the fact that our society as a whole still does not respect the life of a Black woman. So this not believing the Black woman, not listening to, hey, I'm in pain, hey, something doesn't feel right. You would think they would listen because, hey, a person should know their own body, but not believing in these Black women, it leads to symptoms being ignored, which leads to complications like how Charlotte talked about with preeclampsia or preterm birth. If the mothers aren't listened to, then they won't get the proper care that they need. And it's just a never ending cycle of this Black maternal health crisis. So that's it. Does anybody want to add anything?
I like that you made the connection between society not believing in Black women and, and the outside, like the outside world, where it's, political, just anything else, and then connecting it to them not believing us in the medical field. I never looked at it from that perspective, but I think that just it tied in really well. It showed a lot why would they believe us in the healthcare field if they don't believe in us when it comes to things that are just as great. Um, so of course we all know Kamala lost the election. And I think that shows a lot how no matter how great of a woman you could be, no matter you could be the standard and you could still get knocked down. And then that translates to healthcare. You could say you're feeling so sick, you're not there, and then they don't believe you. You're indestructible, you're okay, you're a strong Black woman, you're fine. And they knock you down. You're fine. So I like that. Janae or Cameron, Yvonne, did y'all have any?
I will just add real quick, the reference to our organization, to how we can take action. So the best way that we can combat this problem as far as Black maternal health and the mortality rate is joining the Action Network for the New Orleans Maternal and Child Health Coalition. Just making sure that you obviously participate in these kind of organizations can obviously really help you understanding the problem, how serious this is, you spreading the information, you I guess even just helping to decrease that rate of Black women dying during birth.
Yeah, getting involved is definitely really important. I know I chose this topic for our last project too, and I worked with the Institute of Women and Ethnic Studies in New Orleans, and just with talking to them, they talked about how like having these conversations are important, but also getting out and doing something is important because we can talk about it all we want, but if we're not actually helping with the research, helping with the studies, helping at marches, helping with protests, going to these council meetings to try to make policy changes in our favor, we have to start doing something, make a actual leap toward the progress that we're looking for.
Yeah, because I think a lot of Black women know like their personal story. Like they might know like, oh, I'm affected, but they don't realize like how big of a like national problem this is. I know for me personally, like I didn't really like I knew like obviously Black people are treated differently like by all doctors, but I didn't realize like how important it was for women specifically and how much like the mortality rate is so different. So yeah, definitely talking about it and like doing something about it so that everyone knows. Because I feel like if everyone knew, it would at least help everyone to help, and then we maybe wouldn't be as bad as we are right now.